for the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Our first guest here today is Robert Schonendorf from our St. Tammany Parish Hospital Sleep Center. Welcome, Robert.
Good morning. Thank you.
Can you first, tell us a little bit about your background and what you do at the Sleep Center?
So I've been in sleep for going on 10 years. I've been the manager of the sleep lab for a little over 2 now. Before this, I was a sleep tech working nights. We're located in Covington, right off of Highway 21, where we do sleep studies.
All right. So I guess first give us some tips. I know the summer's coming up, and so kids kind of need different sleep than adults. Can you talk a little bit about that?
Yeah, so yes, I think school's out this week. The biggest thing, I guess, with kids, regardless if they're children or into the teenagers, you still want to kind of establish the same amount of sleep. You don't really want to have them sleeping all day long because then it just throws off the sleep schedule. Depending on how old they are, they typically need different amounts of sleep. The younger ones, kindergarten through 8th graders, usually need about 9 to 10 hours a night. But as you grow older, you require less sleep. So then, 11th and 12th graders, your 17, 18-year-olds, only need about 8.5 hours of sleep.
Okay. So. And so if kids aren't getting enough sleep, what are some of the things that parents might look out for?
Obviously, if they're not sleeping enough at night, it's more difficult for them to get going in the morning. The parent goes in and out of the bedroom numerous times, I'm sure, to try and get them up. Falling asleep during school. If they're not in school, then maybe abnormal hyperactivity, acting out. But obviously their attention span too, they won't be able to hold that attention as long because they're not getting that refreshing sleep or that sleep in general at night.
Well, and besides those, I guess, kind of symptoms, what other things can happen that affect a child physically or mentally when they don't get enough sleep?
Just that, so it kind of messes them up through for the next years. It's not a learning curve, but it just affects everything going forward. So there are some things, there is obstructive sleep apnea, not all that common in children, but it can happen, especially if they haven't had tonsils or adenoids removed, just affecting their airway. Teenagers, they just naturally want to go to bed later and sleep in later in the day. And I guess that's okay during the summer because as long as they stick to that same routine. It's whenever they start going to sleep a lot later and maybe waking up earlier and then the next day going to sleep late and sleeping late till 11 or noon, you still want to kind of stick to that same pattern, within an hour or 2.
Okay.
Because your body sleep is cyclical. So, your body stays on this, wake up, sleep, or wake up, operate during the day, go to sleep, kind of routine. So.
Okay, so if you kind of mess it, if you're sleeping all different times of the day all the time, it's really not healthy.
Yeah, and it's a common mistake what a lot of people think, whether it's kids or adults. So, they think if, Monday through Friday, go, sleep 4 or 5 hours a night, and on Saturday and Sunday, I'm gonna, rest, sleep all weekend to build it up. Mm-hmm. There's been studies to where it doesn't help you. Like you come around, if you sleep all weekend and you come back to Monday morning, your body hasn't recovered because you're throwing it out of cycle. So it's really just to kind of keep within that hour or 2 window of when you wake up and go to sleep.
Okay, so that common thing, I know I would probably say it too, like, oh, I'm just going to catch up. I just need to catch up on my sleep. That's not really a thing.
There's no catching up. It might be short term, but then, come the end of the day, you'll be dragging again.
Okay.
So, yeah.
And then you mentioned teens earlier. Can you talk a little bit about drowsy driving? Because I know with teens, we're already kind of nervous that they're driving in the first place.
Yeah,
I'm sure driving tired is not healthy.
Yeah, there's enough distractions, with the phones, and then if they're in the car with their friends and all that, and then to add on top of that, if they're sleepy and driving, it's just a no-no. It's just a no-no. My mom, growing up, When I first started driving, going to school in the morning, she would always make me get up an hour before I had to leave for school because she wanted to make sure that I wasn't going to be sleepy driving. So it didn't matter. I had to be up and moving an hour before I left for school. So it was rough.
All right. So what are some other things that people can do to kind of optimize their better sleep, just in general?
So, not just for the children, teenagers, but adults as well. The number one thing with technology nowadays, keep the electronics out of the bedroom. Even if it's just that little bitty charging light on a phone or a laptop or on your cable box, any kind of light sets off endorphins and triggers the brain to release basically a wake up kind of a drug. So keep the electronics out of the bedroom. You really only want to use the bed and bedroom for sleep, because if you get in the habit of coming home from work, showering, going straight to bed just to watch TV and hang out, it's again, your body's cyclical. You want to keep with the same patterns, and you want to be able to tune your body to where when you go to bed, you go to sleep, not hanging out,
right,
and all that. So.
Okay. So I know something that has come up recently is home sleep studies. We haven't really talked too much about sleep apnea. Can you tell us a little bit about that before we talk about the home studies?
Like I said, sleep apnea is really not as common in children, but it does exist. But more so common in older, overweight men. Sleep apnea is when you basically stop breathing at night. Your airway wants to close. So there are devices out there to help you breathe at night, CPAP machines. It's essentially just forced air down your throat. So you'd wear a mask, and it keeps you breathing throughout the night, which is something essential.
Right, definitely. We're going to talk a little later about diabetes and kind of healthy eating. Can you talk a little bit about why it's more common in people who are overweight?
So as you gain weight, so if you have an airway, as you gain weight, you not only expand externally, but internally as well. So if your airway is, an inch in diameter and you gain a lot of weight, your airway will shrink, therefore just making it easier for the flap in your throat to want to close. Okay. So blocking off that air. Losing weight is a big fix for sleep apnea, but a lot of times there is more complex stuff going on that really only a sleep study can tell. So we address that as well.
Okay. So what most people think of as sleep studies is going in and
Yep.
having to sleep in a strange bed and have a bunch of wires hooked up to you and
having
that sort of thing.
strangers watch you sleep
Yes,
and all that.
Exactly, which I think is probably why most people have undiagnosed sleep apnea.
Well, I think that's why. So we started doing home sleep studies. We really saw a boom about 2 years ago. We were doing them before, but not very many. So home sleep studies, the patient comes to pick up the device from us at the center, takes it home, sleeps with it that night, and then just returns it the following day. It's a lot cheaper. It does a really good job of ruling out the sleep apnea portion, so if you breathe. But if you have other stuff going on, insomnia, PLMs, which are periodic leg movements, like kicking and twitching throughout the night, if you have other stuff going on, doesn't do a good job of testing for that, because we only see a couple things with the home study. But it does a good job, like I said, of ruling out the sleep apnea, the breathing portion.
So can it tell you if you take this home and it says you're not breathing, then they can say, oh, you have sleep apnea, and then give you a fix? Yeah,
then going forward, depending on what insurance is they handcuff us and they determine a lot of what we do. But then, your doctor going forward, will then find the best fit for you, whether it's CPAP or if it's not sleep apnea that you have, whatever else may be needed.
Okay. So. And can you I see you brought the
so this
machine
is our,
and kind of show people what they would take home and
our home study device here. Really cool. So we
I'll help you.
just a little device that straps to a belt, an elastic belt. So this goes around your chest. We will measure your breathing effort. So as you try and breathe, your chest expands and contracts. So we measure your breathing effort. There's a pulse ox. It slips on your finger. It picks up your oxygen level and heart rate throughout the night. And then there's also a nasal cannula that goes under your nose. Just like if you were in the hospital, you have an oxygen cannula. So we pick up your pressure. So essentially, we're just monitoring three things. So your breathing effort, what you're trying to do, your airflow, what's actually coming out, and then if your oxygen drops down. So typically, so if you're not breathing, you're not taking in oxygen, which is essential. So that's why we monitor that the oxygen saturation.
Okay.
So if you stop breathing, your oxygen drops.
Okay.
So like I said, it's really lightweight, really simple to use, quick turnaround time, and cheap, which is what the insurance is like. So
And it's also something easy, something you can do at home, which I'm sure makes people a lot more comfortable.
totally. And I think that's why, we're seeing higher numbers now than ever. We figured at some point we're going to test everybody in St. Tammany Parish.
Oh, wow.
But, we're seeing a lot of new people come through because that old stigma of, oh, I got to go in the lab. I have to have all these wires. I have to have someone watch me sleep, has really kind of gone out the window. If it works best for you, we've got the home study option now.
Okay. And so, yeah, like you said, you've seen kind of a growth in people who aren't afraid to come anymore and just trying to live with it.
Totally.
And is
totally,
it kind of dangerous to live with sleep apnea?
Yeah, because if you have sleep apnea, you stop breathing. It's just a matter of how many times a night you stop breathing. But so as you stop breathing, your oxygen drops, and it just puts more pressure on your heart. So it's a leading cause for heart disease down the road. Your body is meant to sleep. Sleep is meant to restore your body. And if your heart's working, even when you're sleeping, when it's supposed to be resting, it triggers the heart conditions down the road.
Okay.
So.
And then I guess, can you tell us a little bit about if you do end up having to come in for a study, what kind of does happen then?
So there are two ways to get a sleep study. Your primary care physician, cardiologist, whomever can order the sleep study, and we would get that order, process it, and schedule a time for you to come and get the device from us. Or you can come see our physician in clinic, Dr. Lauren Davis. She's in clinic typically 3 days a week. You would see her first, and then she would order the sleep study from there. Typically, most patients follow up they like following up with a sleep doctor, whether you have another sleep doctor that ordered this study or Dr. Davis in clinic.
Okay. And if they come in, I know we joked about them being watched. There's not somebody standing in a window watching them.
No, by any means, no. That is a big stigma of people. We're not going to sit there and watch all night long. We monitor, whether it's the brain activity, the muscle activity, the respiratory stuff. We monitor all that, but no, we're not just
staring at it.
Yeah, we've got better things to do.
All right. Well, thank you so much for being here, and I appreciate you sharing this great information about sleep. Hopefully, more people that need them will get some sleep studies done soon.
Absolutely. Thank you, Amanda. So we are open Monday through Friday. If you do want to call us, it's 871-5987. We're located on Highway 21, about a mile down from the hospital.
Thank you so much.
Thanks, man.
And I'd like to thank Robert for being here today, and we'll be right back with a diabetes educator from St. Tammany Parish Hospital.
The North Shore. It's our place, where finer things are sometimes the simple ones. Social, sweet, and spirited, but always in harmony. Around here, life is about great things coming together. St. Tammany Parish Hospital and Ochsner, collaborating in the name of community.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Rebecca Stubenrosch, a diabetes educator at St. Tammany. Welcome, Rebecca.
Thank you.
Can you first give us a little bit about your background?
Yeah, I'm a nurse, 30 years being a nurse, and I got a certification in diabetes education about 15 years ago, and have been practicing on a lesser scale since I've come to St. Tammany. The program that they have is wonderful. We do inpatient counseling, outpatient counseling. So I've actually learned a whole lot more about diabetes and how to help people manage it through this program.
Okay, great. Well, I guess, can we first just kind of talk a little bit about healthy eating in general? Because, for everyone, it's important to eat healthy. So kind of talk about a balanced diet and that sort of thing.
Healthy eating is important for everyone, and since we know that obesity is increasing in all over the United States, but very much so in Louisiana, and it's directly tied to diabetes rates. So eating healthy means we want to have a small plate, not like you see in a restaurant, but a 9 to 10-inch plate, and separate that plate out into sections where you're having some lean protein. You can have carbohydrates, pasta, starches, rice, potatoes. It's all based on serving sizes.
Okay.
It's not eliminated from your diet. We give you a budget, so to speak, and here's your budget for your carbs. You're going to have this many per meal. And we also want people, of course, to eat vegetables, produce. We really recommend eating vegetables with each meal if possible. Fruit is considered one of those carbohydrates that can make your sugar go up, but no one is told not to eat fruit. And the fact, a lot of doctors will say, or people will say, I can't eat anything white. And white bread, while you can, we surely want you to eat less processed foods.
Right.
More whole grains as opposed to white, foods that are a little bit more in their natural state.
Okay.
And it's all portion control.
Yeah, and I know that's a big problem in this country with portion sizes.
It is. We do not know how to eat right. You go to restaurants and your portion sizes are huge, and that's another problem, eating out. Buffets, I mean, you're tempted. I might want to eat healthy, but I'm still going to eat more than I normally would at a sit-down meal.
Okay. And then I think a big thing that some people, don't think about is exercise.
Right.
How important is that?
Exercise is critical to diabetes. It's critical to heart health. It's important if you have lung disease. We all need to move. We were created with the notion that we were going to be moving, and our body works a whole lot better when we do. And we're not expecting people to get to the place where they're, don't have to run. We need to move, and it's recommended that we do something active most days of the week, but 5 days a week, about 30 minutes. You start gradually, and of course it's all based on any problems that you have, orthopedic issues, or if you have lung disease or heart disease. How hard do I work? Do I go outside in the heat of the day? Not usually a good idea for most of us. So finding a place you can exercise inside, starting slow and building, and especially for diabetes, what happens is our muscles use all that excess blood sugar that's floating around in our bloodstream. And so it's very, very important for diabetes. It also makes people less insulin resistant, which is a term a lot of people don't know about, but it's your body's got insulin, it just can't use it well. So exercise helps us use insulin better, which gets the sugar in the cell where we want it to go.
Okay. So you mentioned insulin resistant. Is that something that people with diabetes have, or is that something you can have and not exactly have diabetes?
You can have insulin resistance and not be diagnosed with diabetes, but it goes hand in hand. Diabetes is just a metabolism problem. We need sugar to live. We eat it, our body makes it, and we need the sugar to go into our cell system so that it can be used. And with diabetes, we either don't make enough insulin, which is the hormone that helps it get to where it needs to go, or we're insulin resistant. And insulin resistance is tied to obesity and being overweight. So it's a whole big cycle of issues.
Right. And so I guess that kind of goes into, I know type 1 and type 2 diabetes are kind of different. Can you explain the difference between them?
Type 1 diabetes is that diabetes that we usually see diagnosed in childhood, as young as 1 year. And what happens with type 1 is there's some kind of an autoimmune problem that completely destroys the beta cells in the pancreas. So the pancreas is making no insulin whatsoever. A type 1 diabetic needs insulin to live. And there's many delivery systems. Technology has improved. There's pumps that are wonderful, that make life a whole lot easier, but that's type 1. And it can get difficult during the teenage years for diabetic children to have to eat differently than their friends, to have to check their blood sugars before they play sports and after. So it can be difficult, but if it's, you get good support from parents and make sure that they're educated, they can manage. Type 2 is more commonly seen as we get older. Increases with age and increases with weight. And a big part of that is that insulin resistance. Their body is making some insulin, but it's not being used. And the unfortunate thing with type 2 diabetes that people don't realize is it's going to progressively get worse as we age. But managing it and keeping the complications at bay, the medical complications, that's the most important thing, because diabetes, it used to be that patients would say, well, I'm borderline diabetic. And really, there is no such thing. It's called prediabetes. Your numbers are slightly high, but they're not high enough to cross over to give you a diagnosis of type 2. At that point, exercise, eating better, losing weight makes a huge difference. But the medical complications of uncontrolled diabetes are very serious. Eyesight, you can go blind. It affects your teeth health, your gum health. It quadruples 4 times more likely to have heart disease and stroke. Wow. So people with diabetes have to get their cholesterol checked too, because that's hand in hand. It affects your digestive system. It can ruin your kidneys. So if you're a diabetic with high blood pressure, your kidneys are having a hard time. Circulation all throughout your body and nerve damage. So there's a lot of very serious medical complications that if you manage your diabetes better, you can keep those at bay, which is really the whole thing. We want people to have a quality of life where they're not fighting 5 different chronic diseases as a result of
having diabetes.
Right.
And so you mentioned pre-diabetes and how eating healthy and that sort of thing. So with type 2, it can be prevented usually.
If you have pre-diabetes, you can, so to speak, go into remission with the weight loss and the eating healthier and the exercise. But the chances are, if you change those habits and your weight goes back up again, you can go right back into it.
Right. So that, I guess that's what I'm trying to ask is, so if I'm a little overweight and then, but I've changed my diet. I could end up with diabetes, but if I kind of change my diet, I'm not pre-diabetic yet. It's preventable, but a lot of people who get
it's hereditary
type 2
to a degree,
okay.
But it is also tremendously lifestyle.
Okay.
And another problem with diabetes is we don't get diagnosed as often. You know, a lot of people are walking around with diabetes for 5 to 8 years before a diagnosis comes.
Okay.
And, you know, seeing a primary care doctor, going to health screenings that hospitals provide and churches provide, getting tested, very important to, you know, prevention. Of course, we want to know what's going on in our bodies so we can prevent serious illness. And there's a lot out there that you can do about it.
Okay. And if someone does get diagnosed with diabetes and they come to y'all, what are the kind of things y'all do to help them manage it?
Well, we allow a good hour and a half of time with somebody on one-on-one basis, which is very important. It's very hard to understand. And people have all these preconceived notions about what we're going to tell them and that we're going to wag our finger at them. You can't eat this, you can't eat that. That is not an approach that we take. It doesn't work. We try to help people understand about reading labels so they can know how many carbs they're getting in their meal. We help identify the carbohydrates and the serving sizes. We work with a lot of fake plastic food that looks really real and shows them this is how you put your plate together. We help them realize that you can go to a birthday party and have a piece of cake. You're budgeted. And just support. And there's a lot of emotional distress that goes on with diabetes, any chronic disease, but diabetes is, I can't eat this, I have to take shots, I have to prick my finger. There's a lot to managing it, but we try to help them get a better hold on that. And we always encourage family members to come. But we talk about help them understand their medications better, because that's very important. How to stick their fingers, when to stick their fingers, what those results mean as a indication of their management. Make sure they're following up with their physicians. We talk about exercise, we talk about diet, we talk about general health, medical complications, and we're there as a resource. We make ourselves available to these patients. We hope to get them from that initial appointment into a class where we have 2 classes. One day, the next day you have another class. It's once a month, and it's a wonderful program to go to. They get to talk to other diabetics, and that situation, you're sharing information with other people who are like you. You know, that helps people cope a lot better.
Okay, and that's what I was going to ask that. How long is somebody in your program? Is it just
it can depend. We typically definitely like to see them for that initial, you know, even not just newly diagnosed patients, because diabetes is, you know, people will do really well for a while and then they'll start slacking off, and we want to get them in there, get them remotivated. And we also have dietitians that work in our program, because there's a form of diabetes called gestational diabetes. Okay. So that occurs during pregnancy. So we have wonderful dietitians that help people with their diabetic diet, with gestational diabetes. We have a couple of nurses, and they could come to us initially, do the class, or we do another follow-up with either me or a dietitian. We do an annual, summary. We hope to get them back after a year and just recap, remotivate, because any chronic illness, it's hard to do this day after day after day. And human beings, we lose our motivation. Even those of us that are healthy, it's hard to stay on track constantly. So you need a lot of support.
Okay. Well, great. Well, thank you so much for being here, and I
You're
appreciate
welcome.
you sharing all this information.
My pleasure.
I'd like to thank Robert and Rebecca for being here and just giving us some insight into some healthy things that we need to all keep up with. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.